Okay, welcome everybody. Angel, can you wait? Okay. Whatever diseases you see is not equal to deficiencies you see is not equal to a disease. Okay, so we'll start off. There are 16 vitamins. Okay, there are 16 vitamins. Okay, we have vitamin A, B1, B2, B3, B5, B6, B9, B12, B15, B17. B15, B17 has been taken off. Vitamin C, D, E, K, biotin, betaine, and iodine, inositol. So I'm going to go one by one, and I will stop at the most important ones. Okay, one of the main reasons is what I want to explain to you is each one. There are 3 or 4 important sections in the vitamin sections which I need to stop. Okay, uh, hold the line, hold the line. Can you get the papers from my table on the kitchen table? Okay, so let's go to the vitamin A, first vitamin. We start sharing again under vitamin. Okay, okay. So generally, when we show to a client, they will ask you what is the function of vitamin. So what I want you to do is don't get caught up. I'm not going to focus on everything. I'm going to focus on the key items. The rest of them, you can go and read. Okay, S drive is just a tool. What needs to be done is our intelligence to the findings. So I'm going to show you what's 2-dimensional findings and what is 3-dimensional findings, how to compare, how to talk to patients, and how to what do you call, correct all these status down. So B1 basically is a thiamine, and you need to know 1 or 2 functions of it. But please do not go and sit with the patient and describe every indicator. You don't need. We just need to do 1 or 2 things which is essential. Okay, and B1. So before this, I want to go down and explain to you this. Okay, my way of doing things is when I look at patients, this is what I do. Um, I hear them out very, very carefully. And this is the methodology I do in training as well as decoding cases on the spot absolutely fast. Okay, first thing I will listen is the symptoms. Okay, the question is, are you symptomatic or asymptomatic? So if you see an indicator like B1, how do you know if the symptoms are related to the B1? That is how you have to view. Okay, again, there are 3 kinds of doctors. The first kind of doctors um, are the symptomatic doctors. So we treat symptoms. That's nothing wrong. That's how we have been educated. The second type of doctors are the one who are investigative doctors. That means we look at the investigation and treat the investigation. That is the biggest mistake when it comes to functional medicine. The third kind of doctors are reverse engineering like me. So I go from the other way around. So here too, when you look at an S drive, you should not be like a symptomatic doctor looking at B1 and telling what B1 is all. You got to listen to a symptom. Okay, for example, thiamine. So what is the relationship? So the patient comes with a diabetic comes with peripheral neuropathy, Dr. Selvam. Dr. Selvam is a diabetic specialist. He's a physician from India. Okay, Kim Wong. Okay, somehow Dr. Kim has got. So he comes with B1, Dr. Selvam. Don't look at B1 and interpret. Is it related to the symptom? That is how you have to look. So if you have symptoms, is it symptomatic? The second question you need to ask is it mild, moderate, or severe? Because that gives us the management. Okay, so when I'm listening to patients, this is what I do. Okay, I listen to him. He says he got leg pain, cramps in the night, and he has burning sensation. Then I see a B1. So B1 is related to thiamine. It is a beriberi type. Okay, hardly anybody gets beriberi nowadays. So we have to look at, is it mild, moderate, or severe? If it's mild, moderate, or severe, next question you need to ask in terms of management, is it urgent or important? If it's urgent, our management will change. It's important, then we can change. Next question you need to ask is that what is the root cause of the problem? Okay. If I were to correct the B1 deficiency, would it reverse the disease? Yes or no? So that way we eliminate the minor things. So for me, 2 times 2 is 2. Why? We stop the progress and recover. To do that, we um, we look at the root cause and the damage done by root cause. So if it's a B1 deficiency showing symptoms, it's a damage done by the root cause. So what is blocking the problem? What is blocking the B1 is what we need to look at. If you have this way of thinking, we change the approach to diseases. Okay. So let's go back and I share you again the vitamin section. Okay. Okay. So B1 thiamine. Okay. So that's not so important. The half-life is only a few hours. Okay. So the next one you can see the B1 deficiency there highlighted. The next one is B2. Okay, what is B2? Riboflavin. And it generates, it's part of glutathione. It also helps in migraine and RBC production. So what happens is, let me go back to off the line. And if a patient comes with migraine and the patient is having on let's say migraine or ergotamine, you put him on NACID, and then when you do it as drive, it comes at B2. Okay, what I found is migraine can be related to a B2. So how to treat B2? You have this. So in these, if you look very carefully, you have riboflavin. So what I found is if you take this box out, this is given for pregnant women. Okay, it has got two sets. Okay, it comes as a pair. So all you have to do is take one of these and one of these. You can put in 100 cc of normal saline, put a granula and run over minimum 15 minutes to half an hour, the headache disappears. Okay, what I found is that you can also take a 20 cc syringe and you take 10 cc of distilled water and one pair of each will come down to another 10 cc, so total 20 cc. You put a butterfly needle and gives very slow IV. It should not be faster than 15 minutes. If you do very fast, the patient may develop palpitations and the patient may have sweating or tachycardia. So you give very slowly. As you're giving, the headache disappears. So what we have been taught is to give Ponstan or mefenamic acid or any form of NSAID for headaches. And I found that numerous patients improve on the spot on giving an intravenous thiamine, riboflavin. But riboflavin, like I said, is not available separately, it's available in there. And you charge 200 ringgit per single procedure. So if you can do that, you have recovered your money today. Okay, are you okay there, doctors? It's the skills that makes money, not your techniques, not your knowledge. It's the skills. Okay. Okay. The second one we are going to share with you. Okay. After thiamine. Okay. The next one will be B3. What is B3? So each one of them you should know. What is B3? B3 is niacin. So if you see cholesterol very high patient, you can have niacin rich food. So if you look at the product that I have to reduce cholesterol, um, it is RK cholesterol. It's available in the compounding pharmacy. But what happens is when you give niacin, you'll have very prickly sensation. You have very hot rashes all over the body for 15 minutes to half an hour, and then this goes off. Some people will have very bad reaction. So it means that B3 deficiency is basically related to cholesterol. And then you have B5. B5 is again pentatonic acid, and it involves in production of sex hormones and red blood cells and rest of it. Okay, B6. B6 is simple. B6 is basically pyridoxine and a formation of red blood cells and amino acids, and it prevents complications in diabetes. So what you need to see is in my production of RK diabetes, I would have added vitamin B1, B6. So B6 is one of the reasons why there is an insulin resistance. Okay, and I don't want to go through the pathways. The important ones I'll tell you. Okay, sometimes B6 is associated with anemia. So when patient comes pale and we do a blood test and then we look at, the pathologist will write it or hematologist will write there as normoblastic normocytic anemia. That could be a B6 deficiency. So a lot of them will have vague symptoms coming with B6. So it's not very specific unless you do a peripheral smear. Okay, so I'm linking a two-dimensional test, a blood test, to a deficiency which is wrong. You should link it up to a symptoms. It should be three-dimensional. Is person symptomatic for what reason? Okay, always anemia. That could be a B6 deficiency. So let's go to the next vitamin. The 16 vitamins we have covered. Some of them will be uh, sorry, B6. The next one will be, can you see it's B9? Okay, today I posted in the WhatsApp group on B9. Okay, what is B9? Folic acid and prevents complications in defects in the child. Okay, I'll come back to this, and it prevents homocysteine. Okay, can you see methylation cycle? I'll come back to this. The next one will be B12. Why B12 is important? Okay, I will stop here and let me explain to you in a diagrammatic form. Okay, are you all with me? Okay, when you see B12, this is what it means. You take a paper and draw like this. This is methionine. Sorry, before that, sorry. Draw a diagram like this for the patient. This is the food. Okay, food. B12 is absorbed there. B12 absorption starts from the mouth, and then it comes in, and you have parietal cells. The function of parietal cells is to produce hydrochloric acid, and it also functions as uh, intrinsic factor. So this intrinsic factor will tag to B12. So what can cause B12 deficiency is one, PPI or antacids. Number two, okay, it can be a gluten problem. Number three, vegetarians. You must carefully ask history of diabetes. Patient may be taking metformin. Okay. Number five, it could be H. pylori. So don't look at the symptoms and start trying to be a diagnostic doctor from a test. We should have this intelligence to connect it to these and its symptoms. So many times, if you would have noticed, and you would have whacked all these based on this. So the only way they get B12 is through meat. Vegetarians will be less of B12. So most of the food is fortified with B12. So when you see a B12, this is the meaning of it. The other way of seeing B12 and uh, the other way. So this patient would have gone for multiple scopes. This patient would have gone for multiple scopes, and it comes back to a negative. If you look in operating theater, when they will do a scope, they will not look for, they may not be an ulcer, but they'll take a biopsy of the mucosa and test it for H. pylori. But they are not testing for B12. Okay, and I've seen many patients go for multiple scopes and they still can't find anything. And so what you and I need to do is to give a B12. So they're taking adequate food. There's something is not absorbing because of these reasons. So for to do that, what you and I need to do is to give a B12 injection. Okay, methylcobalamin. Give, it will come as a single dose, 500 micrograms. You give IM and not IV. IV, it lasts for a very short while. If IM, it does the first liver bypass. So once it does the first liver bypass, suddenly you see the gastric symptoms improve. Okay, my mother went for 3 scopes, they could not find anything. Today, thinking back, it is a nutritional deficiency. Okay, and I find if you combine vitamin D3 and B12, they improve symptoms faster. Why? Is because what I found is sometimes the gastritis is related to autoimmune. Numerous cases of autoimmune are overcome. So what I do is I sometimes combine with vitamin D3 injection. Okay, and so for the Malaysian doctors, per injection you charge 12 ringgit, sorry, 25 ringgit. So half-life is around 6 to 7 days. So we are charging 4 injections. 4 injections is $100. So if you are injecting for 100 patients in a year, you would have made 10,000 ringgit. So this is how we lose money because lack of intelligence. It's okay. The other one is D3. So if you add D3 injection, you charge 150 ringgit per injection. Okay, you can give every 2 weeks or one monthly once. Per injection is probably 150 to 200. So it covers your cost of this your intelligence. You see, they have to pay for your intelligence, not for the deficiencies they see. You're healing them. You're a healer. Okay. Uh, and another thing I want you to be careful when you think of B12 deficiency, you can ask for H. pylori test, blood test, H. pylori. But there's another thing I want to show you from my perspective, okay, from a molecular medicine perspective. Okay. So when you draw this diagram, they can clearly see they'll be going down to one clinic to another clinic. Okay. And okay, the other thing you need to know is methionine. This is a biochemistry which I'm showing. Methionine. Methionine converts to homocysteine. Homocysteine converts to methionine, and you require betaine, and it also requires TMG. Okay, and OD has 4 rings. It has got 4 rings here. The first ring is B12. This is B9. This is BH4. This is urea cycle. So that means if you have a deficiency of B12 here, this, it means that homocysteine is not able to convert to methionine, and methionine is not able to convert to homocysteine. It means you're having a fatty liver. So you can catch fatty liver before your ultrasound. It also means that your blood vessels, you're developing an early block. Next question. This is a damage done by a B12 deficiency. What is the primary or what is the root cause? So these can be blocked by heavy metals like toxic mercury, cadmium. It can be by chemicals. It can be by alcohol. Okay, it can be by drugs. So you need to look for these, the root cause and the damage done by root cause. So all you need to do for this patient is give B12. IM and subsequently change it to oral. So this means you're catching and inflammatory. So in our regular test, in our regular medical practice, we would do HSCRP, which is not significant. And then we don't know what to do with high levels of homocysteine. And then we give vague excuses. So all you have to do is to understand the simple diagram and go back and learn a little bit more. Okay, how we are able to do an ultrasound, ask them for ultrasound, and but we are in molecular medicine, so we catch it faster than anybody else. Don't look at a test and interpret. Look at the person back and ask him, what is your symptoms? Are you having gastritis? Are you having autoimmune? Are you having alcohol problem? Are you on drugs? So by the time you take this kind of history, you're able to tell this is a deficiency. Okay, and I found that atopic gastritis can be related to vitamin C deficiency and B12 and vitamin E. By the time that the pathology sets in, it does not show on your HPE on the day. It takes a few minutes, a few months, or few weeks for the pathology to start. Okay, especially you have to also look for gluten when they're having a B12 deficiency. Okay, so that is the one aspect of it. The second aspect, the third aspect of this I want to show you is what called methylation. Okay, methylation. So Dr. Kim is here. She's a gynecologist, and Dr. Kim, you'll see a lot of patients with infertility. This is what you'll find. So this is methionine, and it requires homocysteine. Okay, this requires betaine, and this requires B12, and it requires B9. B9 is folic acid. So what happens is this is 5, 10 methyl tetrahydrofolate. So it donates one molecule and it becomes 5 methyl tetrahydrofolate. So this is a molecule that passed on. This is where the methylation occurs. And if you find for pregnant ladies with a B12 deficient, B9 or B12, you need to correct. If not, they develop spina bifida. Okay, I can go on from here to explain that you need to give a patient not folic acid, you need to give methyl folate because this is the active component of folic acid, active component. Okay, so you want to get a person's pattern. It can be anomalies of the B9 receptor. So you need to get this corrected. Question is, what is damaging this? It can be inflammation. Inflammation can be external or internal. What are the external influences like radiation, pollution, toxic metals, chemical? Internal, it can be, this is the whole thing is the liver. So something is damaging the liver and is causing a poor absorption of B12 and B9. So we need to clear out the liver to get this absorbed better. Okay, are you with me? Okay, are you with me? Can you put up? Yeah. Okay. So next one. Please understand the lady sitting in front of us is looking to get pregnant, and it's our intelligence that prevents her from getting all the abnormalities. So we have covered B12, okay, and B12 we have covered. So it can be part of anemia. B12, okay, B12 anemia, protein synthesis, RBS. So you have 4 types of vitamins, B12. So most of them will give them methylcobalamin. Okay, okay. So this is a diagram I drew for you. It can be pernicious anemia, gluten, VAC antacids, and the patient may present with methylation problem, depression. Depression is one of the problems with methylation of B12. So the moment we give an injection, their mood will improve. Okay. Next, I've drawn all this diagram. So one of the important factors that I request every doctor here, you're my colleagues, You go and Google for articles, B12 and anemia, and learn a little bit more. B12 and diabetes, B12 and hypertension, B12 and liver disease, B12 and leaky gut, B12 and folate deficiency, B12 and in anxiety, B12 and autoimmune conditions. I tell you what, every day if you can do this, by the time you finish in a week, you're a better doctor. So the test that shows B12, do not take it as a investigative doctors. Oh, B12, but he doesn't know what's the meaning of B12. So if the patient says, doctor, I'm a hypertensive and I'm on this particular drug for a long time, and then you found B12 deficiency, that patient is developing homocysteine levels high, or the patient comes with diabetes and then you found a B12. So that means he could be taking a drug or is not able to convert glucose, it is insulin resistant factors, or the patient comes with anemia and you did an S drive and you found a B12 deficiency. That is a microcytic anemia, or the patient is alcoholic and then you found a B12 deficiency. So that person can be having a liver diseases. So that is how you and I have to look at three-dimensional. So as the patient is talking, you're looking molecular. As the patient is talking, you're looking at molecular. And from molecular, you're able to correct it by giving a small injection of B12. It's that simple. Okay. So what do? Weekly, okay, and you can give oral supplementation. So next one is B15 has been taken out, B17 is taken out. Some of us will give this. You must please understand, it's not about these sprays. That's a basic mistake we do. We are correcting an underlying metabolic disorder, okay? And vitamin C, okay, vitamin C is a very big topic. I strongly suggest you and I to go back and read vitamin C and cardiovascular diseases, vitamin C and diabetes, vitamin C and aging, vitamin C and endothelial dysfunction, vitamin C and collagen diseases, vitamin C and arterial health. If you and I can do research, this kind of research, that's when you see vitamin C, you know what it means. Most of us, we do look at vitamin C, oh, for whitening of the face, and then you don't know that person is the the arteries, the arterial wall requires proline and vitamin C for its strengthening. So lack of vitamin C is basically, it means that the endothelial lining and the musculature is weakening. Okay, so you require both proline and collagen. Okay, next one is D3. So D3 is very important. Okay, and I will again draw another picture of D3. Okay, are you all with me still? Can you put up the fingers? Yes. Okay, you can hear me. Huh? D3. Okay. Okay. This is what we do. We do D3. Okay. So we do a laboratory test as doctors. Oh, D3. Then what we do? Okay, Ila, you take D3. This. That is a two-dimensional doctors, and they don't know what they're looking at. D3, where is the D3 deficiency coming from? They don't ask that. Oh, okay, you got D3, you take, you can go to the pharmacy and get, but the intelligence is lost. So I'm going to show you the intelligence. Okay, what is D3? So when you look at D3, hold on. When you look at D3, this is how you have to look at it. Okay. So in a blood test, we look D3, we don't, but we are not three-dimensional. So you draw this diagram for the patient. Vitamin D3 in food. Okay. So the person is having food, it coming here, gets absorbed D3. D3 gets into the blood. and then it has to be deposited in the liver. It gets deep, it was comes out absorbed as 25 hydroxy D3, which is not active, and it has to go into the kidney as 125 hydroxy D3, which is the active component. So if there's a deficiency in our blood, we don't see all these. But if you see an S drive, it means it can be one, it can be one, it can be two, poor absorption, it can be a liver problem three, it can be a kidney problem four, or all the doctors are missing the sunshine the whole day in a clinic and it's not absorbing D3. So these are the 5 reasons why a person you can see D3. So when you draw this diagram, our blood test that we are doing is representing only the plasma. But the S drive, you can ask yourself whether his patient is having adequate food or spending too much time indoor, or whether the gut is not absorbing, or whether there's a liver problem, or there's a kidney problem. So we can do specific investigations to find out, not about D3 levels, we find out what is the root cause, not the result of a root cause. This is a deficiency resulted probably in a kidney diseases. This D3 is a result of a liver diseases. These three deficiency is a result of poor absorption. This D3 is result of not having enough exposure. This D3 is a result of you having not having enough food. Not the other way around, look at the results and say, hey, D3 deficiency. That doesn't work that way. Sorry. So again, as a medical doctor, intelligence, you have to ask yourself, patient says, doctor, I'm a hypertensive. Then what is the relationship of hypertension and D3? That is how you and I have to look. D3 is a very, very powerful anti-inflammatory. Okay. And if you do HSCRP is high, and then you find D3 deficiency. So what is the relationship of HSCRP and D3? Because D3 causes increase deficiency causes increased inflammation, like say tumor necrotic factor alpha. So where is the tumor necrotic factor alpha? So when we do the HSCRP, we are lost doing the blood test. Okay. Okay. Somebody else is late. Okay, so the other thing, so when the D3 is low, you have inflammatory markers coming up. The patient may be having cancer. You wouldn't know. Okay, so we, as a doctor, for me, when I'm looking, I'll ask a very careful history. Doctor, I'm having all these aches and joints pain. Then how do you compute three-dimensional? So my question is, okay, a patient comes with, let's say, I'm going to give this talk another 2 weeks from now called frozen shoulder. Okay, so I asked doctors, uh, what are the factors causing shoulder pain? So it can be capsulitis, it can be adhesion capsulitis, it can be torn ligament, or it can be acroclavicular ligament tear, or it can be a muscle tear. Okay, or you could have a fall, you could have had a fracture. Then what else? It can be mineral deficiency, it can be magnesium deficiency, it can be a D3 deficiency, it can be a calcium deficiency. What about other problems? It can be related to autoimmune problems. And I find a lot of patients having shoulder pain are related to autoimmune. For that reason, when we give RK0, the one I developed, in 5 minutes, they can lift the shoulder. Okay, so it could be a neck problem, it could be a cervical problem, or it could be a thyroid problem causing frozen shoulder. It could be GERDs, it could be a gallbladder, but on the left side, it could be a heart. So we need to have this kind of intelligence to be able to tell rather than doing, let's do an X-ray, let's do an MRI, let's do this. Dr. Selvam, if you're in a rural place, you think it's there's MRI? No. So what happened to the intelligence? This is the challenge I'm saying. It could be triggered by what is blocking the D3. I want to know what is blocking the D3. Okay, the person is having severe autoimmune condition. Okay, so if you see some of the teachers teaching outside, they'll talk about immunology in detail. Okay, it causes tumor necrotic factor, it causes interleukin 6, and this is how it acts. Hello, just correct the D3, all this will disappear. That is why don't get carried away by one single so-called guru. Please have a balanced thinking. Okay, balanced thinking. You are very special doctors to me because you carry a message to heal. Don't get carried away by somebody else telling that's the most important thing. It doesn't. It works on a balance. So it could be a thyroid problem causing a shoulder problem. Okay, you get the thyroid corrected, but what is the primary causing it to have deficiency? You need to correct the root cause. So 2 times 2 is 2 again. Find, stop the progress, recover. To do that, to find the root cause and the damage one done was also. So damage can be the pain in the shoulder, or the patient is having a very active rheumatoid arthritis or osteoarthritis. And the root cause can be a nutrition, or it can be something that's blocking. It can be toxic metals. It can be it can be chemicals that's blocking. Okay, then you get corrected. Once you remove these, correct these, you reverse the disease. So D3 has been able to overcome 48 diseases. Okay, one of the doctors in India, by the way, Dr. Renu, is gives a long lectures on D3. I agree with her and don't agree with her. And the reason is her dosages are very high. What I do is I eliminate all the root causes and also give D3. So my doses are low and they overcome all these conditions. Okay, but if you're a Chinese having a B12 deficiency and D3 deficiency, I seriously suggest you to get a OGDS done. You could be having a polyp or you can be having a CA sitting there. Ask them to do a colonoscopy or at least do a cancer markers or an ultrasound, please. So we have to go beyond the investigative type of doctors. Oh, D3 deficiency, huh? What does it mean? Okay, so if D3 deficiency, if they what you give a stat dose of 6 lakhs in India, that's what the doctors are here, 6 lakhs, Dr. Selvam, stat dose, and you continue with 5,000 IU with K2. Okay, K2 every day for 5 days a week. I usually use 5 days, not 6 or 7 days. The reason is to cut down the toxicity. They don't have to work the liver again and again. Okay, what is the half-life of 25 hydroxy D3? 25 hydroxy D3 half-life is 15 days. Okay, 125 hydroxy D3 is half-life is 15 hours. So don't worry about all these details, but what you need to know is where is the problem happening? How is it this person having a D3 deficiency rather than looking, oh, you are less of this, you take. That is a layman. So we are professionally doctors and we are beyond intelligence. Okay, so Dr. Raymond, you are seeing Dr. Chain. How much is my brain worth? I just showed you the figures. We worth few billions. So you are equal to me. So we have to uplift to the next level. Okay, we have to have a elevated experience of transforming our intelligence to the results, not the results to the intelligence, which what most doctors do. And some doctors get carried away by certain teachings out there to share that how do the pathology. I too can draw blindfolded the immunology or the pathways, but it means nothing. What is the root cause? You correct the root cause, it get corrected. So what happens when you follow them? Or you give this, you give that, you give this. Ultimately, you're giving 4, 5 different stuff just to overcome a single problem. Okay, the way I manage is very simple. Okay, let's say Dr. Raymond, you came with some illness. All I'm looking is what is the one thing I can do to overcome your problem? Just the one. Okay, if I have to rob Dr. Raymond's house, I will go front door and back door same time, not one at a time. So this is the problem. So I've seen many doctors practicing, give this, give that. Hey, the person is not on experiment. The patient has a family behind and they're financially tight. Okay, so you need to minimize and maximize the effect. To do that, we use our skills as a doctor. So every doctor here is a colleague of mine, a friend of mine. Okay, I need you to elevate our experience. So go back and read D3 and hypertension, D3 and diabetes, D3 and autoimmune, D3 and skin diseases, D3 and gut health. You will be amazed by the information you get. So when the patient is talking to you, doctor, nights I cannot sleep very well. Sometimes I have burning sensation. You know immediately it can be a D3 deficiency, magnesium deficiency, calcium deficiency, B12 deficiency. What are we doing? We give an NSA ID for the pain. What happened to our intelligence? So the S drive is just a tool to show there's a D3. The D3s must be related to the way I look at things. Okay, I have developed my products based on intelligence, not based on some theory. Okay, so be very careful the methodology you're doing, because we are watched by Malaysia Kementerian Kesihatan. In India is Indian Medical Council. Okay, so we need to balance between functional medicine and allopathy. Okay, if you're going to go into other fields, I'm not responsible. Okay, like I showed you that I am going to take you international to speak to so many other doctors. And when you speak to doctors, they will tell you you're giving these are, you know, you're giving these are, you're going to get that shock. So please get the priorities right. What is the root cause? What are the effects because of the root cause? You correct the root cause, you cause the damage by the root cause, you reverse diseases. Okay, so I'm amazed by a lot of doctors who have the knowledge but unable to convert. Okay, so let's go to the next one. D3, okay, prevents health and everything. Okay, aging. Okay, D3. So if you see diagrams like that, don't get worried. I actually drew the other way around diagram. Okay, okay, if you look at it, bone health, intestines, tumor, okay, inhibits, okay, placental, okay. Next, what to do? So if you see a D3 deficiency, you can ask for OGDS, colonoscopy, renal profile, liver profile. Okay, it can be related to a thyroid problem, cancer, bone diseases, hypertension. So when you look at a blood test, you must look what is beyond that, and especially like psoriasis, they are lack of D3. And what will be the normal dosages? It will be around 5,000 international units. You can give orally by capsules or drops. Okay, there is something else that I forgot to explain. D3. Yeah, okay. Another thing about D3 on hypertension. All doctors above 50, please start taking D3 because you're softening your bone. Most of our doctors work very hard. Our consultation room doesn't even have a window. Okay, we don't see the sunlight. So if you have D3 deficiency and you have hypertension that is related to renin angiotensin. So if the D3 is less, renin angiotensin goes up. If you normalize your D3, your blood pressure goes down because it reduces the renin angiotensin. So D3 has got multiple functions, and 80% of the world is D3 deficiency in spite of sunlight. Okay, so all doctors, please take D3 because it's related to inflammation. Inflammation is the first step to diseases. So in my training program, I'll show you 10 causes where it creates inflammation. Okay, 10 different indicators, external indicators and internal indicators. Okay, and so it's very important that you go back and you and I go back and do research. So instead of we watching other people's WhatsApp trash, they'll dump this article, that article as though they're expert. Actually, they don't read. All you have to do is to Google D3 and backache, D3 and headache, D3 and thyroid, D3 and hypertension, D3 and diabetes. But you write the D3 and diabetes relationship, then you see all the research articles. So I've read thousands of articles. That's why me doing molecular medicine looks so simple to me. Okay. And my thesis I'm writing is about folic acid versus methyl folate in pre-pregnant women, which I'm going to submit, start off my research in March next year. Okay, it's one of the requirement. Next. Okay, vitamin E is basically antioxidant. All of you can read up, and it's not the main. It is not the main framework. Okay, vitamin K. Yes. Okay. In the newer test, you see vitamin K1, K2. Okay, K2 is for uh, K2. Let me come back. Let me come back. K1 is for clotting. K2, it means that you are having the calcium absorbed by the body is getting deposited in your coronary vessels. If you have K2, the calcium absorbed will go into the bones. So if you see K2 alone, it means that you may be having an early start of a block. That's the meaning of it. If you find a K2 deficiency in your S drive and the patient is hypertensive, most likely is developing an early block. So you don't have to have this block is at molecular level. It's in the formation. So that's how we apply intelligence. Not, oh, this is the test. Oh, why are so low? That's not how you see. You have to relate it to the symptoms and the disease condition. So if you correct this, will it correct the hypertension? Will it, if I give this, Dr. Selvam, will it change the pathology or the future of the disease? Yes or no? Simple. If you give vitamin E, will it change hypertension? Yes or no? If you give vitamin C, will it change hypertension? Yes or no? If you give D3, will it change the blood pressure? Yes or no? So if you do that way of doing, you'll be able to focus on the root causes. If you say yes, then what is causing the deficiency? Then you go after what's causing the deficiency, you reverse diseases. This is how most of my products are made, through molecular pathways, to biochemical pathways, okay, to metabolic pathways. And that's how I get most of my drugs, most of my products developed. Okay. And coming back to sharing the next part of the program, this thing. Okay, biotin. Biotin is related to, is also called B17, is related to hair and muscle. These are small things. Please go back and read. Okay. Most of the doctors here are my colleagues, and you're very intelligent to this. So take the time and read up when you're free. Okay. Betaine. So I just showed you about betaine, how it blocks. Betaine improves memory, detoxes the body, blood pressure, improves immunity, detox, everything. Okay. I'll show you this part. Okay, hair loss. Vitamin A. Vitamin A, please read up, is an antioxidant, not something spectacular. Okay, and I want to come back to betaine again. Okay, just hold on. Can you come up? Come up, come up. Okay. Um, betaine. Okay, betaine you saw. I'll draw the picture again. It's very, very important. Betaine, this is methionine to homocysteine, and this is requires betaine. Betaine has to convert to TMG. This is in the liver. So that means this is fatty liver. And here comes B12, B9, BH4, and urea cycle. This, remember, this is Audi car. Audi has got 4 rings. Okay, so what I want to do is give everyone a break. Uh, a break. Stop recording.
Can we pause?
Okay, pause recording. Okay, so the next chapter will be antioxidants. Antioxidants. Hold on. Okay, functions of antioxidants. Okay, so so you need to know why you're taking antioxidant. It gives vitamin C, phytochemicals, an antioxidant. It reduces cholesterol, few things like that. Okay, so I'll run through this very fast. Except I'll stick down to 2 places. Okay, anthocyanidins. Anthocyanidins is from here. Is an antioxidant. Okay, carotenoids is carotenoids. Okay, if you look at flavonoids, these are flavonoids. Okay, this is taken off. This is polyphenols, dark colored. Okay, um, SOD. I'll come back to SOD. Okay, can you see superoxide dismutase? Okay, superoxide dismutase is coming from here. SOD. Okay, sulforaphane. Sulforaphane comes from cabbage. Is this thing is a very powerful antioxidant. Next is alpha lipoic acid. Okay, alpha lipoic acid. You can see that basically CoQ10. So I'll write few things down there. I'll go back to writing on the whiteboard. You can go through phytoestrogen. Phytoestrogen, basically, you need to know the pathway of estrogen pathway. Estrogen, progesterone to testosterone. If it's a male, what does it mean? If it's a female, what does it mean? Okay, you need to know these pathways, huh? Cholesterol to pregnenolone to progesterone to cortisol, DHA to estrogen, E1, E2, E3. So you need to know the pathways. So when you're looking at that, if it's a male, you need to understand what's happening. Okay. Okay. Let's stop here and I will go offline. Not offline. Okay. So let's go to CoQ10 first. Okay. CoQ10, it comes down for everybody by the age of 40. And the highest amount of CoQ10 is required by the heart. Okay. And it's utilized by mitochondria. So when you see a CoQ10, basically there's a mitochondrial dysfunction. So when you look at an S drive, CoQ10 is not CoQ10. That is, means it has got a massive oxidative stress. Okay. CoQ10. So if you learn immunology, now they're going to show you this pathway, that pathway. They are not telling you what is causing the CoQ10 deficiency. So we get dragged away by this immunology, this biochemistry, instead of finding what's causing the problem. If there's an autoimmune condition, if you find a CoQ10 deficiency, that means there's a mitochondrial dysfunction. So it can be myasthenia gravis, it can be a muscular disorder, it can be an autoimmune condition. So we need to correct the CoQ10. Okay. So where does the CoQ10 stays? Okay. So if you look at the electron transport chain, if you look at the electron transport chain, chain 1, 2, 3, 4, 5. This is complex 1, 2, 3, 4, 5. CoQ10 sits here. So you have a NADPH, DPH to NADP. So here you have a FAD. So it has the molecule that has to be transferred to here, to here, to here, to here. So there's something that's blocking here as causing. So if there's a CoQ10 deficiency, that means there's a massive oxidative stress. Okay, that is one. So if you look at this is directly looking at mitochondria. That means there's a mitochondrial dysfunction. If I were to do an S drive and I find these deficiencies, copper, tomorrow, next time we'll do copper, zinc, manganese, okay, manganese. Then you have uh, molybdenum. It means that this is the oxygen, it is bi radical. So for it to be activated, it has to be reduced because it's not a stable compound. So it has to be O2 minus. So you add an electron. When you add an electron, it becomes a superoxide. So what you're seeing as superoxide is this. So it's a radical. Okay. So once it goes down further, you add another electron. It becomes a O2 2. This is a peroxide. So for a peroxide, if you were to add two hydrogen atoms, it becomes a hydrogen peroxide. This is radical, but for it to be becomes a very powerful, oxidative stress. It takes transitional metals like you add manganese, zinc, copper, then it becomes a hydrogen hydroxyl radical. This is what whacks the whole thing. So now when you find vitamin E, vitamin C, and with all these deficiencies in a test, you're actually looking at mitochondria. That is why Restore corrects mitochondria. Okay, so when you see CoQ10, look for related. Is it related to the heart? CoQ10, is it related to the um, autoimmune conditions? Okay, and I found that most of the patients having a massive amount of autoimmunity is because of either superoxide dismutase that you see, or you will see uh, your blood test HSCRP will be high, and we're not sure why is it high. Okay, the other deficiency that you're looking at is sulforaphane. Okay, sulforaphane. Okay, sulforaphane is something that I want to discuss with you. Very, very important. So sulforaphane comes from broccoli and cabbage. So it breaks down to another product called glucoraphain. Glucoraphain breaks down to isothiocyanates. Here it requires myrosinase. Okay, and it breaks down to sulforaphane. So you see a sulforaphane deficiency. It means that this breaks down to another component called NRF2 or nuclear reactive erythroid derivative 2. This goes into the cell, and it goes into the cell as NRF2 KEALP1, and then it goes into the nucleus as NRF2 ARE, and then it comes out. This is the normal mechanism when you take broccoli or Brassilia group of vegetables, and it goes down in every 29 minutes. If it's excessive oxidative stress, it goes in 88 minutes. The most important thing about this is it means that what does sulforaphane mean? Sulforaphane prevents cancer. Very specific cancer would be pancreas. and other cancers. It's a very powerful antioxidant. So I will tell you the secret. So if you find a D3 deficiency, vitamin C deficiency, you see a sulforaphane deficiency, most likely your cancer is in formation. So to discover cancer on S drive, you have to do 500 tests, not 1, 2 tests. And if you have plus B12, okay, when you have this combination, especially Chinese, please get a your what do you call biomarkers, cancer biomarkers, and get a ultrasound done, scope done. Okay, so what is important is this. This is the breast. So you have something called adducts, ADDUCS, adducts. So if you have sulforaphane and you are using radioactive, you can see it deposited here. It protects the cancer, breast cancer. Okay, but what they found is your chromosome 2 p53 genes, when it gets mutated due to massive oxidative stress, that is when it triggers breast cancer. So to prevent that is PQO1 from broccoli and the cabbage group prevents this. So when you see a sulforaphane deficiency with viruses plus D3 deficiency and many others in a woman, most likely she may develop breast cancer with selenium. Okay, you need to have many combinations. Don't go and give this particular uh, solution, that solution. Fine. The woman sitting there in the front is prone for breast cancer or cervical cancer. So you and I are very intelligent. I will come this to the next round when we're talking about minerals and antioxidants and many other combinations. So I can catch cancer ahead of time by doing all this. So I'll actually tell you, do this. You're prone 5 years from now, you may be prone for this 5 to 10 years. So you can also find thyroxine deficiency. So it needs several combinations to be able to catch a cancer ahead of time, not wait for cancer markers. I'm beyond cancer markers. Okay, I've done more than 10,000 tests. Okay, for that reason, uh, I'll be recommending some of our doctors to teach other doctors internationally. Okay, because you and I are going to be beyond most other doctors' intelligence, not going to pathways to find out what is causing this mutation, what is causing this genetic mutation. So what happens when you take an antioxidant? This is exactly what happens in an antioxidant. One antioxidant, when you take an antioxidant plus an antioxidant, one will become weaker antioxidant. It doesn't go off. So basically, this is a benzene ring. So you have where your free radicals will get stuck these places. But in a antioxidants, it'll appear like this. Okay, this one appears like this, circular. So it keeps rotating. So it cannot lock in like this. So this is called delocalization. Delocalization. So an antioxidant becomes delocalization. That is why it's able to become an antioxidant. So this is the function how antioxidants work. So that is why we need to have a lot of antioxidant to remove the massive oxidative stress. Okay, end of the day, we're not taking a medication to stop a disease. We need to find what is the root cause. Please do not disturb the drug. The drug must be there. Over the period, as the parameters improve, you can reduce the drug or totally remove. A drug is also useful. Don't not use something to do with traditional medicine, Chinese medication to do something else. Please understand the biochemistry, the metabolic pathways, the mechanism of action, what is the root cause, what is the damage done by root cause. You correct all these, you save thousands of lives. Please understand, your brain and my brain is worth $1 billion. Don't get carried away by so-called guru who can cure cancer, who can cure this. That is not intelligence. Intelligence is able to transfer what I know to you, and you are able to heal others. Don't be the Maha Guru. Please share the information to others. The information is given to us to give back to society. For that reason, you and I are worth billions. Right? Would somebody, Dr. Kalpana, come and say, Doctor, can I come? Can I come and train doctors worldwide, and I will give you $1 billion? It'll never happen. So don't get carried away by emotions. We are special people. We are very intelligent. It's just that we have to elevate it. I'm just giving you basics in a S drive. How to look at S drive is just a tool. It's just a tool. Like you see, vitamin A deficiency, it taken 75 days to develop a vitamin A deficiency. It didn't come overnight. Okay. So when I know that you're not ordering these, somewhere you're lost. Not because the product you need to. Somewhere your intelligence is lost. Right. So I want to stop here. So we have now it's 11 plus. Okay. When do you want to have the next training next week? Please tell me. I can come anytime. I want to stop the recording. Huh? Sorry.